Right now in the United States, over 20 million people are taking either proton pump inhibitors such as Acifex, Nexium, Prevacid, or Prilosec, or H2 blockers such as Pepcid and Tagamet. And many people now are self-dosing, self-medicating because they can buy it over the counter. There are stronger medications that are sometimes written by prescription. But the thing to keep in mind with all of these is that they do not correct reflux. They may neutralize the acid so that what is refluxing is not acidic, but they do not do anything about the underlying disease. And with time, reflux tends to worsen as we get older and as that lower esophageal sphincter weakens. So although they are successful in relieving symptoms in up to 60% of the people who take those medications, it is a chronic disease. It does not get better, and the medications do not make it better. And of course, in patients who do aspirate, they may not be aspirating acid, but they're still having gastric juices go into their lungs, so they can still get asthma, they can still get aspiration pneumonia. If they have bad aspiration, they can still be bathing their teeth and their mouth and their gums in the gastric contents. So it's even if they do not experience the symptoms of heartburn, they can still have the reflux. And as I said, it tends to get worse with time. Up to 15% of people who have Gerd will develop a Barrett's esophagus, and that Barrett's esophagus can ultimately lead to development of esophageal cancer. Even if it does not do that, it can cause strictures, it can cause pain, bleeding, ulcers. There are so many problems that can occur because of this chronic disease. So what has happened now is that we have a segment of people who have been on proton pump inhibitors and H2 blockers for a long time, and we're starting to see some of the chronic effects of this. Now, these are not totally innocuous drugs. Even though you can buy them over the counter, many people experience diarrhea, nausea, constipation, headaches. But we're also learning that long-term use may be associated with osteoporosis, with fractures. It may be implicated in development of chronic kidney disease and end-stage renal disease, low magnesium. There's some concerns that there may be cardiac effects long-term. Alternatively, we're now able to treat almost every hiatal hernia and reflux patient laparoscopically. In our practice, we use the Da Vinci robot, and so we do a robotic-assisted procedure that usually takes an hour or less, and we can either do a fundoplication or the LINX, and the majority of our patients are home the day of surgery or the next day, back to normal activities with 1 to 2 weeks, and eating a normal diet, and best of all, not refluxing. Now, not every patient has the reflux 100% resolved, but even the folks that do have some continued mild symptoms have a marked improvement in their lifestyle. They're able to sleep lying down, they're able to eat a normal diet, and their sleep patterns are not disturbed because of the reflux. So we strongly recommend that patients consider having their hiatal hernia repaired and some type of an anti-reflux procedure, whether it's the LINX or a fundoplication. It is a very straightforward, safe procedure. It's very successful. Most patients, over 98% of patients who have this surgery done, experience a marked improvement in their quality of life and say that they would have it done again.